This is my CEP 605 final for Tiffin University. My name is Logan Wright. For my intro to exercise metabolism, the supply of ATP is critical for ongoing muscle contractile activity during exercise. The metabolic pathways in muscle that ensure continual ATP supply are PCR degradation, glycolysis, and the oxidative metabolism of muscle glycogen and blood glucose and fats. During exercise, the relative contributions of these metabolic pathways are primarily determined by exercise intensity and duration, but are also influenced by training status, diet, sex, and age. During exercise, the maintenance of ATP levels is critical for maintaining sarcolemma excitability, sarcoplasmic calcium release and uptake, and myofibrillar force production, thereby ensuring ongoing contractile muscle activity. Fatigue during varying types of exercise is often associated with metabolic substrate depletion and or the acclimation of the byproducts of metabolism. Phosphocreatine or PCR pathway acts as an immediate ATP buffer rapidly utilized during high intensity exercise. Glycolysis is the breakdown of glycosol units from muscle glycogen and blood glucose produces pyruvate, which can be converted to lactate or acetyl-CoA, depending on glycolysis and oxidative metabolism balance. ATP is generated via substrate level phosphorylation, even without oxygen, so anaerobic energy systems. And an aerobic energy system is carbohydrates and fatty acids produce ATP through substrate level and oxidative phosphorylation, dependent on mitochondrial oxygen availability. This system is facilitated by respiratory and cardiovascular systems oxygen transport during exercise. The anaerobic system is PCR over glycolysis, generates ATP faster, while the aerobic system has a higher capacity. Substrate choice influences both ATP generation rate and total amount, with aerobic fat metabolism having higher capacity than anaerobic glycolysis or PCR breakdown. The next slide, physiological effects of exercise. Recovery from a bout of exercise is associated with an elevation in metabolism. This is referred to as EPOC or excess post-exercise oxygen consumption. A number of investigators in the first half of the last century reported that prolonged EPOC durations and that the EPOC was a major component of the thermal effect of physical activity. Evidence has accumulated to suggest an exponential relationship between exercise intensity and the magnitude of the EPOC for specific exercise durations. Furthermore, work at exercise intensities greater than or equal to 50 to 60% of a VO2 max stimulate a linear increase in EPOC as exercise duration increases. It is now apparent that a prolonged EPOC from 3 to 24 hours may result in an appropriate exercise stimulus, submaximal or greater than or equal to 50 minutes or greater than 70% VO2 max, and submaximal less than 6 minutes or less than 105% VO2 max. The exercise stimuli required to promote a prolonged EPOC are likely or unlikely to be tolerated by non-athletic individuals. The role of exercise is the maintenance of body mass and therefore predominantly mediated via the cumulative effect of the energy expenditure during the actual exercise. Mechanisms of the metabolic pathway. Aerobic metabolism is the primary ATP production pathway in human skeletal muscle for many activities. Anaerobic ATP production supplements or buffers ATP needs when aerobic metabolism is insufficient. Anaerobic energy sources include PCR and muscle glycogen breakdown. Anaerobic systems offer rapid high rate energy production but are limited by substrate depletion and muscle acidosis. Muscle energy storage is low. PCR capacity is about 3 times that of ATP, depleting in 10 to 15 seconds of intense exercise, and glycolysis capacity is three times that of PCR, but requires 90 to 120 seconds before it can significantly contribute. PCR can be rapidly resynthesized in minutes, while glycolysis needs 30 to 60 minutes to clear muscle acidosis. Sprint training boosts anaerobic glycolysis capacity by 10 to 20%, some studies claim, and PCR stores remain unchanged. Creatine supplementation increases total creatine and PCR stores in muscle. Both aerobic and anaerobic pathways contribute to match ATP resynthesis with exercise ATP demand. Anaerobic ATP provision is crucial for intense, powerful sprint-like movements. And early studies established fat and carbohydrates as fuel sources for aerobic metabolism during exercise. And it is predominant substrate at high intensities, while endurance is linked to muscle glycogen. Muscle glycogen depletion correlates with exhaustion. Glycogen content modified by intake. Endurance training increases muscle glycogen content and lowers carbohydrate utilization. Fats are the dominant energy source at lower aerobic outputs, so less than 40% of individuals' VO2 max. Training adaptations and metabolic flexibility. Fatty acid mobilization from adipose tissue during exercise provides fuel for recovery and signals adaptations in oxidative capacity. Single sessions of exercise can rapidly modify the population of adipose tissue cells, which may have metabolic benefits. Elevated fatty acid availability after exercise triggers adaptations to increase oxidative capacity via signaling events like PPARQ activation. And individuals with obesity, particularly severe obesity, often exhibit compromised CRF or cardiorespiratory fitness levels that potentially impact the training adaptations muscles go through. Phenotypic adaptations in response to exercise are determined by the type, frequency, and intensity of exercise, and this is known as the exercise specificity principle. This hypothesis proposes that with repeated exposures to specific exercise modalities, such as aerobic exercise or strength training exercise, the muscle transcript and proteome are fine-tuned, leading to calibrated responses and adaptations to familiar exercise stimuli. And while well-trained athletes in either discipline show an enhanced protein synthesis and mitochondrial content after years of training that support the specificity of exercise adaptations, aerobic and strength training lead to divergent phenotypic outcomes, with aerobic training enhancing mitochondrial content and strength training promoting myofibrillar protein synthesis, or MPS, and muscular hypertrophy. Metabolic flexibility is the ability to respond or adapt to conditional changes in metabolic demand. This broad concept has been propagated to explain insulin resistance and the mechanisms governing fuel selection between glucose and fatty acids. And this idea highlights the metabolic inflexibility of obese and type 2 diabetic patients. Inability to increase fatty acid oxidation in response to lipid availability is seen in obesity. The ability to enhance oxidation during exercise is an indicator of metabolic flexibility. In response to a 3-day high-fat diet followed by 10 days of exercise training, both lean and obese groups exhibited similar increases in fatty acid oxidation in skeletal muscle. Endurance exercise training improved metabolic flexibility in individuals with obesity, as evidenced by increased fatty acid oxidation during exercise. During endurance training exercise, aerobic ATP resynthesis relies on carbohydrate and lipid oxidation. The choice of substrate depends on factors like exercise intensity and duration. Higher intensity endurance training leads to increased carbohydrate utilization, mainly glycogen, and longer duration at a fixed intensity promotes lipid oxidation, utilizing those free fatty acids from adipose tissue. Endurance training increases the capacity of skeletal muscle to oxidize carbohydrates and lipids. Mitochondrial biogenesis leads to increased volume density and respiratory capacity. Endurance training improves the rate of oxidative phosphorylation, leading to better maintenance of phosphocreatine levels and quicker PCR recovery after exercise. Endurance training leads to a reduced reliance on anaerobic pathways at exercise onset, increased reliance on lipid oxidation, and improved metabolic flexibility. Blood lactate concentrations decrease and glucose uptake is reduced. Compared to endurance training, the metabolic responses to strength exercise is less studied. Acute strength exercise leads to significant declines in phosphocreatine and muscle glycogen, with glycolytic metabolism being dominant. Muscle glycogen concentration drops by about 20 to 40% during strength exercise, and intramuscular triglyceride declines by 25 to 30%. Fiber type specific responses are observed with larger declines in type 2 fibers. While the focus in strength training is on muscle hypertrophy and MPS or muscle protein synthesis, MPB or muscle protein breakdown regulation is less emphasized. Muscle hypertrophy results from the balance between these two, and strength training leads to muscle hypertrophy primarily due to increased muscle fiber cross-sectional areas. Despite limited data on specific metabolic changes, strength training often improves fatigue resistance. Acute metabolic response alterations might include reduced metabolite accumulation and glycolytic pathway reliance during endurance exercise post strength training. Nutritional considerations during exercise, muscle glycogen and blood glucose are key sources of carbohydrates. Fatty acids come from intramuscular triglycerides or IMTGs and adipose tissue triglyceride stores. The relative use of carbs and fat for energy during exercise is primarily determined by exercise intensity and duration. Training status, diet, age, sex, and environmental factors also influence this. These factors collectively shape the balance between carbohydrates and fat utilization during physical activity. At higher exercise intensities, particularly in competitive athletic events, carbohydrate oxidation, primarily from muscle glycogen, becomes dominant, and this is due to its faster energy production rate and its role in sustaining intense efforts. Maximal fat oxidation occurs at around 60 to 65 VO2 max. However, fat oxidation decreases at higher intensities due to lower plasma fatty acid availability and intramuscular factors that limit mitochondrial fatty acid uptake and oxidation. The regulation of metabolism during exercise involves a complex interplay of local and systemic factors. For example, muscle glyconeogenesis is controlled by both contractions and epinephrine. Various factors, including changes in substrate levels, hormones, electrolytes, blood flow, and body temp, play roles in metabolic regulation during exercise. Sports performance and exercise metabolism. Although sports performance is multifactorial, muscle performance plays a major role in most sports. Fatigue is associated with metabolic processes in the muscle, and by manipulating these processes, exercise can be maintained for longer, or power output and power speed can be enhanced. Most of the research on nutrition and physical performance centers around continuous endurance exercise. With appropriate food intake, this could influence endurance performance, and this is a widely recognized hypothesis. Considering that games in general and soccer particularly enjoy an enormous amount of participation, it should come as no surprise that nutritional influences on soccer performance have been studied. The literature that has been studied shows that soccer is a glycogen depleting activity and that work volume and work rate are influenced by level of muscle glycogen. The dietary habits of soccer players do not appear to contain optimal carbohydrate intake, given the varied and sometimes minimal amount of time between games. Nutritional assessment and counseling, if necessary, are suggested. to afford the player adequate glycogen stores to work at the rate and volume demanded by the game, ensure adequate carbohydrates to fuel the muscle glycogen storage post-training, replenish fluids and electrolytes lost in sweat by consuming 125% of estimated fluid loss in the 4 to 6 hours after exercise or post-game. Health implications and public health. Regular physical activity can have a profound effect on several various diseases/conditions. Regular physical activity, especially in patients with cardiac disease, can increase the body's ability to efficiently adapt to meet exercise intensity. We call this an individual's cardiorespiratory fitness level. During exercise, there are increases in cardiac output, ventilation, and vascular resistance to sustain the skeletal muscles' workload. Immediate changes to the heart due to exercise include increased heart rate, stroke volume, cardiac contractile power, and oxygen consumption. Regular physical activity for any individual allows for exercise-induced cardioprotection, which refers to the heart's ability to become protected against disease stressors. Exercise allows the body to adapt and more efficiently provide the body with energy used to make such changes. Exercise is medicine, and if the benefits of exercise could be gained through a pharmaceutical agent, it would be the number one selling drug in the world. Exercise can prevent/reduce risk factors for various diseases and conditions such as obesity, type 1 and 2 diabetes, coronary artery disease, multiple sclerosis, and some cancers. While exercise can also help regain range of motion and quality of life in patients who are already diagnosed with said conditions, exercise can help improve just about any condition if done correctly. Exercise used as a regular physical activity can help improve the efficiency of the entire body, regardless of disease status. And then to continue with nutrition and soccer. Football is a game of intermittent work. Players generally perform low intensity activity for more than 70% of the game, but heart rate and body temp measurements suggest that the total energy demand is high. The energy demand may be particularly explained by the repeated high intensity efforts that players are called upon to perform. A top class player performs about 150 to 250 brief, intense actions during a game. These efforts place high demands on the anaerobic energy systems and are a major factor in the fatigue that occurs at all stages of soccer. Carbohydrates is stored in the muscle and in the liver as glycogen. This is probably the most important fuel for energy production and fatigue towards the end of any soccer game and may be related to the depletion of glycogen in individual muscle fibers. If even a few of these are unable to contract, then sprinting ability is reduced and skill is impaired. Free fatty acid levels in blood increase progressively during a game and partially compensate for the progressive lowering of muscle glycogen, but this is a less effective fuel source. The total distance run by a player during a game depends on the many different factors, including level of competition, position, play style, and fitness level. At the elite level, outfield players typically cover 10 to 13 kilometers. Physical demands are increased by the fact that more than 600 meters are covered at sprinting speed. Over the whole duration of the game, heart rate is about 85% of the maximum rate, and oxygen demand is about 70% VO2 max. These values suggest that the total energy cost of a game for a typical player weighing about 75 kilograms would be about 1,800 kcals. The value for players at lower levels of the game is somewhat less than this because the VO2 max is also lower. The total energy expended will be less. Of course, heavier players need more energy for a given run, and energies vary greatly between individuals. There are no easy games for the elite soccer player whose season includes preseason, domestic league, cup games, plus international competitions. Each game is played at high pace with corresponding physical demands. And elite players' clubs will usually provide support and advice, but most meals will be taken from the club. So players must take some responsibility for meeting their nutritional needs. And that is my references.